you?
Hello, hang on, I'll just get a pillow to sit on.
No problem.
Is that better? Yeah.
Yes, you're more propping up. Okay, great. How are you?
I'm well, thank you. How are you?
I'm all right. I'm so pleased that you're able to join us today. So Dr. Naomi 𝐍𝐴 joining us for our lockdown live. I'm super chuffed, known affectionately to her patients and all your followers as just Dr. Naomi, almost like Madonna or Beyonce. So legendary, completely legendary. And you're also the founder of an amazing boutique cosmetic clinic, the Manse. Hey, am I saying it correctly? The Dollhouse.
The Manse.
The Manse.
Oh, you're a mimic.
And amazing, like you're very positive also about treatments. You do a lot of your or have done a lot of your own treatments, and you known for putting your patients at the center of your focus, like for your patients. So it's really amazing to chat to you today. And besides that, you also call yourself the fish consultant, skincare creator, doll maker, and the fairy lip mother.
I know. Sorry, I'm just being an idiot, but that's all right.
No problem. Oh, no problem. I mean, we can see you totally now. Are you comfortable like that?
Yes.
Okay, great.
Last time I did this, my phone fell down, so don't worry if that happens again.
Okay, no problem. It's live, so anything can happen. So thank you so much for coming through. You've got a huge following here in South Africa. People love you. They love your memes as well. It's been making people happy during our lockdown period. But how do you think of daily content, like really funny memes, almost daily?
I'm not sure. I just get inspiration from everything. If I'm happy, if I'm sad, if something annoys me, if I see something I like, or if I think about sort of like the deeper things in our minds, not the superficial. Yeah.
Okay, awesome. No, we love them. And then your clinic, the Manse. How did you come up with the name? Of that.
It was the name of the building that it's in, so I just used the history of it.
Okay, wow, amazing. And then, because I know once you mentioned that you had a hashtag plastic positive and, encouraging people to feel okay about wanting to enhance their beauty, but you might also get patients that are maybe overly enhancing themselves. Like, how do you know when, red flags, and how do you say no? Do you say no to people? How do you say no?
I would say no to anybody who I didn't think we could make happy. Or I would say no, for example, say somebody who says to me, I really want the natural look, and then they keep on asking for more and more and more. You'd say, well, you want the natural look, what are you doing? Basically anyone who you can't make happy.
Okay. And then I see you had some, you can see we in South Africa just almost becoming Rapunzels. Our hairdressers will be closed, and we kind of like in a phased approach. So today is the first day of something called phase 4. We're not sure what that means, but we came out of a hard lockdown called phase 5.
Okay. So it's called phase 4. What's it called?
Yes, phase 4. So we still... It means there's so many things, but like some people can go back to work, and you can start exercising outside within 5 kilometers of your house during certain times, and everyone's concerned if they can walk their dogs, but no hairdressers, no coffees. Now we can kind of get takeout via Uber Eats. I don't know if that's a thing, but I see in Australia that you guys are crushing your curve, as you say, but all the while hairdressers have been open and you take out coffee. It hasn't been such a hard lockdown. How's it going there?
It's going really well. Our Prime Minister is meeting Cabinet next Friday to make decisions about where we're at and what's going to, what restrictions are going to stay. So I can't wait to hear about that.
Okay. All right. Yeah. Here we're not sure if next week some clinics are going to open, some aren't. So we're not 100% sure. But I know
what do you do in your clinic? What do you do in your clinic?
So also mainly non-surgical work, the toxins. We can't say, just like you can't say names and things. It's very strict here.
South Africa.
Yes, and the medical device laws are pretty tight, so which is good, I guess, but it makes you be a little bit creative when you market. So a lot of toxin, filler, PRF. I like injectable PRF, PRP.
What? I don't even know what PRF is.
So
What's
PRF is. So it's a second generation platelet derivative. So they've been using it like in dentistry and things for years and at pain clinics, and it's developed in France. So instead of having an anticoagulant, you just spin the blood in a specialized tube, so it doesn't clot very quickly. But you have 12 minutes to inject it before it clots. So common, some mesenchymal cells, and it's got a lot of leukocytes in it. So yeah, it's like it's but it's the patient. Hey,
what's it good
What's
for?
it for?
What's it good for?
So similar to PRP, just general rejuvenation, pigmentation. You can use it in tear troughs and mix it with filler if you're fast enough to do that. And people use it if you're also fast enough, O shots and all of that. I see you also do a lot of that at your clinic, I'm sure. Yeah.
So we do a lot of it. I wish we did more, but I haven't marketed it very heavily, so I should.
Yeah. It's popular, the O shot, or I know it's a trademark term, or B shot or that shot. Yeah, it is relatively popular, and PRPs also, and thread lifts. People love thread lifts. Yeah.
Okay. Yeah. Which types?
They are PDOs, so we've got PDOs. I know I can't say it, but I don't think anything will happen. Silhouette, like polylactic acid.
You're not allowed to say silhouette.
And then the other polylactic acid thread from Georgia, Eastern Europe, is very, very popular.
You're not allowed to say that. Wow.
But it's we can't because I think it's also classified as a medical device. So
we're allowed to say thread names. That's one thing we can say. Yeah, thank goodness.
We can actually say filler names. They gave us a grace period now of a year where you can, but like ethically, people are not. It's so silly, I know.
That's the stupid. It just makes us look less transparent. I hate it. We can't share information about negative effects. It's really disgusting, but...
Oh, really? Okay.
Yeah. Sorry, I get very cranky about it.
No, it's fine. But something maybe to cheer you up. I know you love travel, and I think, I hope it's going to open up not very soon, but maybe in certain places. Where would you go once we can safely travel?
Oh, I'll go straight to Hawaii, my favorite place.
Okay, and how far is it? Like how far? Like how long does it take you to?
In an aeroplane, it'll take from Sydney. It'll take 10 hours, so it's very close. That's close for us.
Okay. All right, that's not far.
Where would you go?
I would go. My daughter's been nagging us to go to Bali, so we go to Bali. Yes.
I just read an article about Bali today, and it said that the tourists that didn't get to leave are filling the hotels, paying $260 a month to stay there, and the occupancy is like 1%. It's terrible. Bali's in a mess.
Yeah. Yes, because they rely on tourism, actually. So, yes, someone's saying it's too close for us. I know, but for South Africa, it's very far. Like Australia, it's about 24 hours away if we had to fly. But yeah, and it's almost like, when people wish for the weekend to get longer or wish to be stuck in paradise or whatever. But now it's almost like a nightmare.
It is.
Yeah. But
I wanted to ask you something. Can I ask you something? Because I saw that I looked on your account and I didn't have time to listen to the video. It was an IGTV one, but you were going to talk about skin bleaching. So do you do a lot of that or not?
No. So
I don't know what you're going to say.
Oh, that. Okay, so it was just a couple of, they are my friends. So, and we were doing like an Insta Live with them. And, in certain parts of the country, because in our country, we're a very diverse population. So, people do go for, or they want to, skin whitening, skin lightening.
Yes.
So, yeah, we're not allowed to use those terms. But patients do ask
You're
for it.
not allowed to use the terms.
We can't use, so people, I think they'll say skin brightening,
Skin brightening.
but most, so most, I hope most places, most aesthetic clinics usually do treatments for just pigmentation because, like we're talking about red flags, patients that want this extreme skin whitening would be a red flag patient, could never please them. But yeah, they do. And it's not like, I know it's not proven or anything like that, but glutathione IVs are very popular here. And then there's a huge problem with black market bleaching creams and all these cheap creams. So patients present their skin's quite damaged. But I know here they're getting into it now because intimate skin lightening, the Mammalian peels for that area. So that, yes, I think that's popular. And I think that's, that would give patients a confidence boost. But we are just talking about historically why people want to be light. It's like a status symbol. And my colleague was actually saying that even today, it was a study on, it was two different groups of African Americans, and they found that the lighter skinned African American participants would actually get paid more than the darker skin. So still today, it's carrying on. So, yeah. But yeah, it is, I think people do it here, but they use maybe black market creams and all of that to bleach, and then they present to the clinics as a damaged skin. Yeah.
Wow. Okay, so it's not a treatment that you offer, really?
No, but I think there are one or two places that would say they offer it, like go to Shape Life and TC. You do see places that offer that sort of thing, yeah.
Yeah. Okay.
Yeah. Yeah, and then, but I think we all have to be innovative. So, while you're at home, sending out home devices like the LED skin, what have you been doing to be innovative at home for your practice?
Okay, so for my practice, you mean my online store?
Oh, yes,
yeah. Our online store, we've been making special offers so that people can spend some time on their skin. So, with masks, peels. Actually, no, I've got an offer with a peel coming up, so I haven't done that one yet, but we've done some masks. We've done some strong A offers, because people have the downtime during isolation. We've done the home LED. Although maybe isolation is going to be finished soon. I really hope so.
Yeah. I think mentally people need it to be over. It's like a very odd experience people are going through. So I think it's mentally affecting literally everybody. I see someone ask, "Dear Dr. Naomi, how can I access your blogs?" And that's actually like 10 years ago when I came across your blog. It was a very patient-centered, it was very, very intense, very comprehensive. So do you still blog? Do you still have time to blog? They were really nice blogs.
Thank you. I used to there was one year, many, many years ago, where I wanted to write one a day, so I put myself under this stress to do that. But now I don't write the best blogs now because I think my creativity is all gone by doing the Instagram 5 times a day or 10 times a day or 20 times a day, however many I do it for all the accounts. So sitting down and writing a good blog post, I just don't do it enough. But I was thinking of doing my Instagram, changing my Instagram so that each post is a blog post, but that's going to take so much work.
Yes. Yeah, and someone said your posts are daily pick me up. See, they are.
Oh, thank you so much. Thank you. Sometimes I'm trying to do that. Sometimes it's more, I'm a bit, I don't know, not as inspirational.
And then, yes. So now, you started out as an injector, but I'm the founder of your clinic, but now you're more like a face architect. So when did you stop doing injectables, and why did you stop injecting?
I had done it for so long. I'd just been injecting so long, and I was so busy. I was so exhausted. I was really burnt out. I just needed a rest from it. I just wasn't enjoying it.
Okay, but you enjoy the planning stages of...
No, don't enjoy that. It's too... No, I used to enjoy that, but now it's more, I don't know, I enjoy the social media more than the clinical.
Yes, well, you're very good at the social media, so I think it's amazing. And then I know you love fashion. You used to do these sort of outfit of the day posts. So do you dress up? You still dress up?
This is how I'm dressing. This is how I've dressed for like the last 6 weeks. The same outfit. Yeah, no one feels like fashion now. Do people feel like fashion? Yes. Do you feel like fashion?
I think for these lives, I dress up for them, just for them. But but every day.
Show me your outfit then. Show me your outfit.
It's just like a very typical, like a Bali. A Bali inspired outfit. But every other day I also work for the states. I also work for the government, so that's like scrubs and gowns and shields.
What do you do for the government?
I'm actually a dentist. So a dentist do injectables. So I'm a state dentist. Yeah.
Oh, okay. Oh.
Yeah. So it's very different during the day. So I take the lives as an opportunity to wear some things in my cupboard. But now, because all the clothing stores have been closed, we're running out of things. So that's also another cool thing that's going to happen today. So clothing stores are open. So
great.
And then there's something cool. There's something I saw on your thing, and I know you speak about it a lot. Someone says we are very cute. Thank you. It says here the currency of celebrity only holds its value both sides profit up. What do you mean? Like, what are your views on? Or I kind of get it, but like if you I know you said this whole time is the collapse of this sort of culture. What are your feelings about this celebrity culture? Like, what do you mean?
I don't know. I think people are resetting how they feel about that. It's not, I don't know, we're getting back to, how could I put it, to what's really important, not these fake lives,
True. Yeah, I know. Like during this time, usually like people would check out celebrity accounts or this or that, but people are so focused on surviving and then thriving, improving themselves. You don't get time to go check that out. You are trying to catch a Zoom webinar and whatever aesthetic thing. You actually have to have a timetable to catch up on all of those. Yes.
Yeah, one of my friends, an injector from Hawaii, she's the biggest celebrity lover I've ever met. She's obsessed with celebrities, all of them, and she's even unfollowed them all. It's amazing.
Oh, wow.
I'm shocked. I can't believe it. I never thought I'd see it. She's become more of a conspiracy theorist, which is weird.
No.
Which is, I know, which is what a lot of people are doing.
The cause of all this. I know. And, sometimes when you read those things, it makes you doubt, is this real? Is that, so you have to stay away from fake news. And it is crazy. I know once I've gotten onto, this Illuminati conspiracy, and I thought, should my kids even be watching Disney? I mean, is this okay? I have to start reading this stuff, So, also you have to go on a information diet. And then, have you been doing anything for yourself at home? Self-care wise? What is that?
I have not. I've been so exhausted. I've been doing a lot for in the last week for my college, which is Cosmetic Physicians College of Australasia. So I've spent a lot of time on that. I'm trying to develop protocols for when returning to work, so how to make it safe for everybody. So the protocols are out now, so that job's done. I haven't done enough. I plan to take my big LED home and go under it every day, but I didn't manage to do that. I was average with my skincare. I've read a lot, but that's normal.
Yeah, no, I also brought, well, not the big one home, but the LED mask home. And the dermapen I also brought, but I haven't done anything.
Oh, you haven't done it yet?
No, I haven't. So, I have big plans and going to do a peel for my husband, but nothing happened. And we might have to go back next week. And I thought, geez, I haven't done anything. So, yeah.
Oh.
And
someone just asked me a question. Dr. Naomi, what should one do when they have asymmetrical brows? So this is really interesting. You've got to first of all, you've got to look at which side they like the best. But what you often find is they like the side that it's more difficult to make the other side like the good side. So that happens so often. But you can either, so if you want to make this brow lower, then you can relax up here, or if you want to make that one higher, you can relax here so it goes up. So
yeah. So that's toxin, but what are your thoughts on thread lifts in the area? A thread.
We offer them. I think they're really subtle. I think in the overcorrection stage, they're big, but then I think they go down a fair bit.
Yeah, so I saw one of your things on foxy eyes. That's because that's one of the other questions I wanted to ask you. What are the terrible trends, like the worst trends you've seen in terms of aesthetics recently?
The worst trends.
The worst. I know people always ask, what are the best trends? What's the best thing that's coming out? But what are the worst things you've seen?
Okay, yeah, I think that is. I just think that is awful. So to me, that's the worst. I like flat brows. I like them going nice and flat because I think that looks better. But my worst that I really, really, really hate is bad placement of cheeks. So when they place cheeks in the wrong place, and that happens all the time. I don't know what's going on out there, but it's really ugly.
Okay.
Do you know what I'm talking about?
Yes,
So they have instead of the high point being up there, they sort of put it here. I don't know what. Yeah, here they put it. Weird.
No, it is. And I think because there was such a focus on mid-face a few years ago and it is important, it is, so people just focus on that and focus without the rest of the face in consideration. And then
someone asked a good question. Is it bad to get a lip lift in the 20s? So
I think you're going to ask you about the lip lift. Yes,
okay. So is it bad? It depends on your anatomy. So you either need it or you don't need it. You're not going to just get one. You just need to look at your anatomy, and are you going to look better if your philtrum's shorter? So it doesn't matter your age really. Obviously the philtrum lengthens as you age. So if you had it done in your 20s, maybe you'll need it done again as you age. But look at your anatomy. Can it be improved, or will it look worse if you get it done? Will you look like you've got a snarl, or will you just look prettier?
Yeah, I was going to ask you, what do you think was the best treatment you did for yourself? What was the best thing?
That's so hard. That's really, 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 really hard. I don't know. There's so many I love. There's so many I love. Probably my jaw widening surgery.
Okay.
You're a dentist, so you'd be into that. Upper jaw widening surgery. My neck liposuction was really good. I love body lipo. What else? I love my eyes really. So from when I was in my 20s, I had really asymmetrical eyes, and so I remember going to a plastic surgeon when I was really young and saying, I want to fix my symmetry of my eyes, but we didn't even have filler back then, so it was really great when we got filler to put in the upper lids, and finally after all these years I got symmetrical eyelids, so that was really great.
Oh, great. And then I actually, I saw your, when you did your lip lift transformation, I thought that was amazing. Afterwards, you looked like you were 16. What an amazing transformation. I think also when people come for lip fillers, often older women, and then they, because they also saw on Instagram and all of that, and they see all these lips, but sometimes filling it won't really make a difference in how they'll have full lips, but like if you look at their full face, it might be better if they go for an actual surgical procedure.
Yeah, so if your philtrum's really, really long and you just can't keep trying to push it up with filler, it just doesn't work. So I used to not put, years ago I used to put a lot in my lips, but then it didn't look great, so I didn't put a big amount in there. But yeah, I'm so happy with my lip lift. The turning point, I was really scared of the scar because I've seen so many bad scars for lip lifts over the years. They're real. Oh, thank you, Mr. and Mrs. Bone. I've seen so many scars, so I was really scared of that. But then it just got to a point, I kept on seeing myself on a video talking, blah, 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 and I was like this. I just thought, you can't even see my teeth, and I hated it. So it was that triggered me.
Okay. And then someone's asking, the lack of tooth show. And someone's asking, at what age should you start getting the B word, the neurotoxin?
Depends on the person and the skin. I think Caucasians need it the earliest in general, like Fitzpatrick 1 and 2. We've got really skin that can wrinkle really quickly. I'd probably choose to get that. I got it when I was 25 or 26, but that's because it only arrived in the country then, so I got it as soon as I could. But maybe if it had been in the country, I probably would have wanted it when I was about 23. But I think some skin colours, you really only need to do it just before it's etching in. What do you think?
So, my youngest patient is actually an Indian patient that I saw, but she had a very strong frown, and she was 21 when we started, and it was strange to do it, but she was, well, obviously legally able to do it, and then she's been doing it, well, and 6 monthly instead of the 3-4 monthly. Up to now, she's 30 now, so it was just because for her it was her muscles that were overly strong. So her skin condition was really good, but her frown, like even at 21, she had like a distinct frown. But I think if you start a little earlier and not be too excessive, if you ask patients in their 30s, a lot of them would say, I wish I started a little bit younger than I have.
Yeah. Yeah, I think it's really important. You know those patients who have a really, hi Angie, you know those patients who have a really strong genetic frown? The last thing we want to have to do is put filler in someone's frown.
Yes.
That is just, we want to not, cosmetic doctors do not want to have to do that. So I think frown is so important to prevent rather than cure later. So muscle relaxants in the frown are really important to get onto early for that reason. We don't want to risk blindness with the filler there. So get onto that one really early, especially if it's, hi Angie, especially if it's in your family and or your mum, your auntie have really strong one. Oh, I need it.
And then one last thing, Insta-fakery. What is Insta-fakery? Like, it's a word that you actually made up. It's like your word. What is So, because people get up with this, I know what it is, but like for people watching, like how can they be careful of Insta-fakery? And, because it's also, we as practitioners get the Insta-fakery pictures and you're like, can you do this? I don't know. So what is it?
It's where the before and afters aren't consistent. So there's ways to manipulate before and afters. So it could be anything. There's so many ways of doing it. The neck could be on a different angle, or there could be some makeup applied to the area to make the lip more precise, the colour change more precise. There could be like breathing in or having this angle. Like there's so many tricks, and I think you've just got to follow lots of accounts and they'll talk about it. So then you'll go, that's that. When you see it on an account that uses it.
And then, as a tradition on our Lockdown Live series, we ask all our guests to leave us with a positive, uplifting message. So if you can end us off with something like, but Dr. Naomi style, positive and uplifting.
Oh, dear. That's no pressure.
Oh, no. It doesn't have to be profound or anything. It just has to be real.
Well, I'll just tell you the rule. This is the rule in my clinic and my rule for my patients, which is however you look at the time, you've got to be happy with it. Doesn't matter if you have a few things that you're planning to do, you want to make little changes. At the time, you've just got to be happy within the boundaries that you've got. So, you don't have the downtime, you can't afford it, blah, blah, blah. So until those boundaries change, just be happy.
Hey, thank you so much, Dr. Naomi, for all your time and your pearls of wisdom and your honesty. I just love how you're just so honest. In real life, on your Instagram, it's amazing. Thank you so much. And be safe. Bye-bye.
Bye.
Bye.